Good morning, teacher. Good morning, guys. We are group number 5, and today we are going to talk about COVID-19. COVID-19 is the new species of coronavirus, and to know more about it, we must first know what its coronaviruses are. What is coronavirus? Coronavirus are an existing family of viruses that can cause in both animals and humans. In humans, various coronaviruses are known to cause respiratory infections that can range from common cold to more serious illness, such as middle is respiratory syndrome and severe acute respiratory syndrome. The most recently discovered coronavirus caused the coronavirus disease COVID-19. Now we can ask ourselves, what is COVID-19? COVID-19 is the most recently discovered infectious disease caused by the coronavirus. But this new virus and the disease is caused were unknown before the outbreak in Wuhan, China, in December 2019. Currently, COVID-19 is a pandemic that affects many countries around the world.
The COVID-19 started in December 2019 in Wuhan, Hubei province of China. This was not yet believed to be a pandemic until in March 11, 2020. On January 7, 2020, China had associated the virus causing the disease performance genome sequencing. The sequencing became available to the WHO on January 12, 2020, allowing laboratories in different countries to produce specific diagnostics via PCR tests. On January 12, 2020, the Chinese authorities has confirmed the existence of 41 people infected with the being felt symptoms between December 8, 28 and February 2, 2020, which included fever, malaise, dry cough, shortness, albeit and respiratory failures. Invasive premiums in traits were also some in both lungs and the chest radiographs. To date, it has spread on the world, and the hope is that vaccine the creating which has very good results, and this estimated that by 2021 it will already available in the market. Annie.
Okay, COVID-19 affects different way depending on each person. Most people who are infected have mild or moderate symptoms and recover without the need for hospitalization. The most common symptoms are fever, dry cough, and fatigue. Other less common symptoms include the following: Asian pains, sore throat, diarrhea, conjunctivitis, headache, loss of sense of smell or taste, skin rashes or loose color on the finger or toes, and the serious symptoms are difficulty breathing or feeling, short of breath, chest pain or pressure, and inability to speak or move. Norland.
How is transmitted? 1. Contact of less than 2 meters of a sick person with talking, coughing, or sneezing emit drops with the virus that go to the mouth, nose, or eyes of the other person. 2. By shaking hands or touching objects and surface contaminated with these drops. Who are the most affected? People who have diseases such as diabetes, cancer, obesity, respiratory, kidney, heart, and immunosuppressive diseases. You should also careful with pregnant women, adults over 60 years of age, and children under 5 years old. Siguiente.
Prevention against COVID-19 is very daily. This is the way we don't have to protect. Number one of the most important ways to preserve using masks. Example, so as not to be infected. Number two, you have very well the use handheld to make it. Example, number three, always keep a distance with people. Number four, which glasses. Example, number five, one very important, no touch your face. Number six, use a glove if you are going to buy from supermarket or cashier. Number eight, clean gloves we enter one home. Number nine, but street food. Number 10, do know 11 home is the more recommended. This step can serve a means of prevention COVID-19. The best thing if you feel bad is to visit a personal doctor. Go to the hospital who's for emergency. Thanks. Siguiente.
Good afternoon. My name is Dennis Gerardo. I'm going to talk about what do if you have coronavirus. Number 1, do not panic. Number 2, you should go to the near hospital to receive the proper diagnosis and treatment. Number 3, do not self-medicate. Number 4, follow the doctor instruction. Number 5, you have to rest at home except to get medical attention. Number 6, you have to rest, stay hydrated, and take prescription drug. Number 7, you have to keep in contact with our doctor for any emergency. Number 8, we have to monitor our symptoms daily. Number 9, you have to stay in a separate room from the other member of the family. Number 10, keep our room well ventilated and if possible, use a bathroom only for the infected person. Number 11, if we have difficulty breathing, call the doctor immediately. Number 12, the person infected by coronavirus should not share food utensils with other members of the family. Number 13, wash the dish and glasses used by the person infected with coronavirus with water, soap, and chlorine. Number 14, consume fruit and vegetables daily. El siguiente.
Economic consequences of the pandemic in our country. This sanitary emergency caused by COVID-19 has affected the entire world in many ways, but the economy has been one of the most affected. Specifically in our country, many of the small businesses to large companies has closed their activities due to the virus. A lot of families are surviving with just a little bit of the money they received before the pandemic. There's a lot of people who has lost their jobs, children and mothers asking for food and money at the streets. Due to the mismanagement of the funds for this pandemic, hospitals are collapsing, and that means that there are less and less probabilities to properly treat the possible infect, which increases every day. And besides all that, all the activities and work have a high risk for people's health due to the virus. Indeed, this situation is difficult to every one of us, but it broke many ideas about how to create a new form of small businesses through social media. Bien.
Joseph,
Oh, apologize. Well, the world in COVID. The world is constantly changing, but the last time I checked, there were around 20 millions of coronavirus cases and 7,047 deaths, and only around the 10% of people that will be 30 millions are recovered. Specifically speaking of this country, there is around 48,000 of cases, and only the 10% of these people who fully recover. Most of the people are old people, and from my experience, neighbor actually get the diagnosis, the last week, and is fully recovered. When we talk about closed cases, only the 14 million cases which have an income, and only the 5% of these cases are terminally sick. That means they're dead.